I think it's important for your listeners to understand that there is no specific number that denotes a deficiency
Yeah,
in an
that's
individual
right.
man. Everyone has
That's
his
right.
own individual number, and you can get fooled by the number even as a physician. I mean, the association of an elevated serum LH together with an increased serum free testosterone is actually an expected and classical finding in patients with functional mutations of the androgen receptor, with due to the pathologically decreased androgen sensitivity, what Rudy is saying. So you can actually have a high free a free testosterone level and suffer from decreased androgen sensitivity. So that's why we do give them a trial of testosterone therapy. I've learned quite a bit from my patients over the years now, men that came in with normal levels, but classical symptoms of a deficiency. And we have the discussion that this is a trial of testosterone therapy to see if those symptoms are related to you as an individual have an insufficient amount for you as the individual. And, more times than not, it works out quite well for them. In fact, I can't think of a time that didn't work out quite well for them. So thanks for bringing that up, Rudy. But, we do have to factor in, androgen receptor sensitivity and their exposure to EDCs and give them a trial of testosterone therapy.